What does it take to become a doctor? These are the real-life stories of McMaster University's med students. On this episode of Med Students, Monali learns to operate on children. Alyson may get some bad news about a residency. And Dhar deals with a potential heart attack in the ER.
And how many days have you had it now?
Well, it just started this morning about 10 o'clock, very severe.
Like a stabbing?
Yes.
Lifetime pipe smoker and he has an arrhythmia though.
Dhar Dalachahi is a second-year student, 5 months into clerkship, the on-the-job training phase of med school.
OU. Tonight I'm going to be doing emergency, and it's part of my family medicine rotation. I'm doing it for 1 week, and tonight I got about an 8 or 9 hour shift, depending how busy it is, and it's usually busy.
As his clerkship continues, Dhar will need to juggle more patients and more serious cases.
Yeah, I think so.
So, why don't you tell me what happened then?
His first patient, Kent, has injured his knee.
Stepped off about a 3-inch step on the front of my house. Stepped down. Stepped down onto the concrete, and there was just a crunch sound, and that happened, just exactly what you heard.
Okay. So I sort of go and see patients, not super urgent life or death ones, but your average emergency patient. I go see them, and I do a history and a physical. After I'm done, I report back to the attending physician. So go ahead and x-ray that. I'll also go talk to Dr. Wellsford. She's the head attending emergency physician on tonight.
Okay.
And see if she's in agreement. And then we'll take a peek at what the x-ray says and decide where to go from there.
Okay.
Okay?
Good.
26-year-old Dr. Monali Misra is a third-year general surgery resident. Despite a punishing schedule, she tries to get to the gym every day.
Usually do about an hour of cardio and then some weights, and I've been doing that for a few years now, so it's been working out okay. And I eat a lot of junk, so this sort of negates it also. No willpower. And it makes you feel a little normal too, you know, being around normal people. You know, not everybody's sick all the time and all stressed out, so kind of helps to have a nice normal environment as well, where you're just like everybody else, not worrying about people dying and crashing on the ward.
But when the workout is over, it's back to her patients. Monali is in the midst of her pediatric surgery rotation. She's learning to operate on children.
It's a totally different atmosphere. It's quite different because first you deal with the parents and also you know, the way you handle little kids. I mean, they're so much smaller and all the anatomy is so much smaller and you have to be a little more careful because a little bit of blood loss is actually a lot for a little kid. So you got to be very careful. And it's actually pretty exciting. I enjoy it. And then when you take off the drapes, you see a cute little kid underneath.
Monali's first patient is 6-year-old Ryan, who is having trouble eating. Under the supervision of Dr. Peter Fitzgerald, Monali will insert a feeding tube into the child's stomach.
Every procedure has its risks. You don't want to poke the needles or cut through into any bowel. You have your risks of bleeding. So, I mean, anytime you're doing any of these procedures, you got to be careful with that. There's always the unexpected. You never can be too confident about everything you do. Things don't always go perfectly.
Stop. Keep going. Don't pull back. Don't ever pull back. Keep going. Okay, stop there.
While Kent waits to get his knee x-rayed, Dhar attends to a patient with chest pains.
This is right.
Armandios may be having gastric trouble, or he could be having a second heart attack.
This morning about 10 o'clock, very severe.
Like a stabbing?
Yeah, stabbing with
pressure.
Okay.
And it emanates up into the lower upper chest.
In the past, you mentioned you've had the MI, and that was in 78.
It was 1 year after my wife died, the anniversary date, so a little psychological effect.
Yeah. It's awful. Is it worse when I touch that? Right there, it's more severe, right? Okay. I think we're done for now. I'm gonna go have a chat with Dr. Welsford. She's the head ER doc right now. And then we're gonna decide what sorts of tests we wanna do. Okay? At this point, I'm not too sure what it is, but like you say, you remember having a heart attack before, having these type of symptoms. And the truth of the matter is that kind of gastric upset won't hurt you, whereas a heart attack will. So we're gonna assume it's a heart attack till we think otherwise.
Oh, that's right.
Okay?
Good, thank you.
All right.
Monali's patient has had the feeding tube passed down his throat into his stomach. Monali's job is to make an opening in the stomach to pull the tube through. Working on a tiny body can be tricky.
He's very thin, okay? You might have just...
Once the feeding tube is pulled through, it needs to be anchored into place. That can also be tricky.
It looks really easy to do. It looks like, oh, you know, what's our problem? But it's actually harder than it looks because you don't want to pull up on it at the same time. You need the exact same position, but I also only have a limited sterile field and I don't want to get it all contaminated anywhere, so I'm trying to push down and it's sticking as it goes and I can't jerk. It has to be a constant pressure.
You sure you're occluding the tube as you go down. Make it looser, okay? Just catch enough of that to go. Make it too tight. Just,
Yeah, that's not.
okay.
It seems easy enough, but there's a lot of mistakes that can happen. It's very precise as well. So, I mean, I think it just takes more practice. It's the first time I've ever done one of those, so I'll know for next time.
Dhar brings in supervising ER physician Dr. Michelle Welsford to have a look at Armandio's.
I've been hearing about your pain.
Yes.
How long has it been there?
Well, it started about 9:30 this morning, 10 o'clock.
Okay.
Very severe right through, and it was very mindful of the period ahead before I had the heart attack. It lasted for about more than a week, the same pain, then after I had the heart attack. So.
Thought you'd come see us sooner this time. Good idea. What we'll do is we'll just do some tests to make sure that your stomach's okay. At the same time, we might as well check out your heart, right? What I'll ask the nurses to do is also give you some medication, kind of like what you took this morning, that may help a little bit with the pain, okay? When I go out, is it okay if you don't mind just getting changed? Okay?
Oh, no.
Okay, the nurses need to come in and do a cardiogram, and we'll get some tests done. When he says it in a way it's similar to his angina, then I take that absolutely seriously. So what we'll do is we'll see if we can move him onto a monitor now.
He's had a heart attack in the past, which presented exactly the way this one presented. So the way I kind of look at it is that if it is stomach pain, that's not going to kill you, but if it's heart pain, that could kill you. So I'm going to assume that it's cardiac right off the bat, work him up as a cardiac patient, and once we rule out a cardiac problem, then we're going to start investigating the stomach.
Third-year med student Alyson Broder has been having trouble deciding what she wants to do when she graduates.
Yeah, I want to be a boarding chick.
Snowboarding aside, Alyson has been agonizing over her residency choices. She wants to stay at McMaster, but she's torn between pediatrics and family medicine. But the time has come for Alyson to commit. She has to register her final choices with the Canadian Residency Matching Service, or CARMS.
So this is my rank order. Right. McMaster Family Medicine is first. McMaster Pediatrics is second. Queen's Pediatrics is third, and U of T Pediatrics is fourth. This is the final button. Hopefully I will get into family medicine, because as I said, I've only applied to the one family medicine program because I applied to McMaster late, and so really if I don't get into Mac Family, that's the only family program I've ranked. Although I still think I would be happy doing pediatrics. I'm gonna print off a copy of it.
Alyson's choices will be compared to how programs have ranked her, and one offer will be made, unless Alyson goes unmatched.
Originally, I think my worst fear was the thought of going unmatched, not getting a residency program, because I am only ranking 4 programs. And even family medicine, MAC is very competitive because a lot of people want to do it. So only ranking 4 programs is a bit risky. For now, it's gone and there's nothing I can do, so I can just go out, have a good night, not think about it.
But it won't be long before Alyson does have to think about it. Just weeks away is Unmatched Day, when some med students get the bad news that they have no offers for residency. Back in the ER, Dhar's potential heart attack patient is undergoing testing. Kent's knee x-rays are ready and show damage to the cartilage.
I'd never experienced pain like that before. Well, what's the cause of, why is the pain? And it feels only when it's under compression,
Yes.
like only when it's under.
And that's because
weight.
all of a sudden, probably what happened is it was probably a little bit rough, and all of a sudden you caught part of it and you tore it. Okay, so now you got a big cut in it.
Does that heal itself?
Well, it doesn't heal up all that well. Cartilage doesn't have a lot of blood supply to it.
Okay.
Make an appointment with your family doctor about a week or so, because you'll probably see your doctor sooner, and call up the surgeon and make a follow-up appointment with him. Okay?
Okay.
I'll get you ready.
Thank you.
Monali preps for her next case, a hernia operation on an 8-year-old.
We're basically just gonna make a cut around that area and find the hernia sac and tie it off as high as we can and make sure we don't damage any of his vital structures. They say in the males the vas deferens, which is where the sperm comes through, the most important structure in the whole body. So gotta make sure we don't do any harm, because that's right near where the hernia sac comes through. Anything like the bowel kind of gets stuck in there, you can compromise the blood supply and kill it off, and he can get very sick. So it's something that needs to be fixed sooner the better.
Monali's first job is to get good exposure of the hernia sac to get ready for the repair.
You always got to be ready. Even the most routine cases, can cause a lot of problems. You're always near big vessels somewhere, so you got to be really careful.
I wasn't nervous until yesterday, and then yesterday I was so nervous.
Unmatched Day has arrived.
Last night I was really nervous going to bed, and this morning I'm really nervous. I could eat my breakfast afterwards, but I want to eat it now, so then I can delay going to look at the computer. And I get klutzier when I'm nervous too. If you go unmatched, people know. It's not a secret. And word spreads very fast about who went unmatched.
Alyson checks the CARM's website for what could be bad news.
It is competitive, and there's a lot of very good candidates that you're competing for spots. There's nothing there.
The website is down. She'll have to wait.
Well then. I guess I'm nervous for longer.
In the meantime, Alyson can focus on some recent good news.
Well, I've met a really nice guy, and that's probably the thing that I'm really happy about. They very similar values and what we want out of life, and even more so, want to stay in Hamilton and do my residency here at Mac. And that's really, he would really like that too.
Alyson's day could turn into a bit of a nail-biter. And to top it off, she's working a shift in infectious diseases. It's her first day on the job. Dhar is still waiting for results to confirm if Armandios is having a heart attack. He's off to yet another new patient.
Why don't you tell me what happened then?
Went into work and went to grab my lime samples.
Okay.
We got to do lime samples every hour.
Okay.
Well, I went to pick up the bucket and I dropped the bucket and the way it hit the floor, it just blew up in my face.
Are your eyes hurting right now?
Just the side.
What is it, like a stinging kind of pain? Or
Yeah,
what? Yeah.
like a grit.
Okay. Does it feel like something's in your eye?
Yeah,
Only that left eye, though.
just the left eye. There's stuff in the other eye too, but
Yeah. Yeah, it's very red.
yeah.
Okay. And this is the one that hurts the most.
That's the one that really hurt.
It's pretty bad. It's awfully red down there. Do you have any trouble seeing things?
Just blurry, kind of.
Blurry? So when I looked at it, I mean, it's bright red, both eyes. Left eye in pain, right eye no pain, but both eyes watering. Checked his vision. So, I don't know. What do we do here? Just rinse him out?
Yeah, so we should rinse them out.
Dhar freezes his patient's eyes before flushing the lime out with saline.
Always learning something new, and that's what really does it for me, is that every day there's 3 or 4 things that I see that I never even knew existed.
A little bit.
That's the good thing about medicine, is throughout your whole career, you're going to be learning new stuff. It's hard, eh?
Yeah.
Do you feel a lot of pain in the eyes?
It's just that one there.
It's still hurting you, this one?
Yeah, a little bit.
Almost done.
There we go.
You all right?
Yep.
Okay.
Probably do you a lot of good to have that flushed out a bit more.
So far, there's been no bad news about Alyson's residency. She turns her attention to a patient with rash and respiratory problems.
I woke up in the middle of the night, scratching my palms and noticing that there was some form of hives beginning to form on my palm, and the configuration is very much the way you see it right now.
I've seen some mild allergic reactions before, but I've never seen a rash like that was so diffuse and throughout the whole body. Is it painful or is it just itchy now?
It's just itchy, and it's pretty much only itchy on the places where it's constantly in contact with things, like where I have to sit and, and lay my legs and stuff.
So how long do they tell you they think this might take for this to go away?
They haven't said for sure. I think they're planning on at least 3 days of observation.
Yeah.
I'm fairly sure that once my breathing is fully stable and they're sure
They'll be
that it's in
able to-
remission, I'll be able to go home.
That's good.
So just underneath.
Monali completes the hernia surgery. She ties off the sac to repair it.
So he just needs to strip the protein.
I'm still learning. I haven't done very many of them. Every tip they say, helps you to do the next one even better. So you just sort of work on it. But it went well, so I didn't do any damage. So I think it went well, actually. So it should be all right. We were able to do it without any problems. Didn't run into any complications. So I'm just happy. I'm always crossing my fingers. Don't want any problems. So things went well. So actually, maybe I should actually go answer this, and I'll be back.
Monali is paged by pediatrics. 6-year-old Ryan, who had the feeding tube inserted, is having post-operative seizures.
Yeah. Yeah, bye-bye. Sorry, I gotta go up. A little kid is seizing, so I'll be back.
Okay. It's like a Q-tip almost.
Now that his patient's eyes have been flushed, Dhar takes a swab to see if any lime remains.
Just compare the color.
It's all clear.
It's looking good. And then this is a prescription for the eye drops.
Okay.
Okay?
Okay.
Alrighty then. Thank you very much. Best of luck then.
Thanks.
Goggles next time. Goggles or something.
Yeah.
It's after midnight. Before Dhar heads home, he gets to give some good news to his heart patient Armandios.
I'm going to be leaving, so the next ER doc will take over. Okay, and like we said, we think it's unlikely that it was your chest this time around. That's good news. Okay, all right, have a good night then. I think as for looking towards the future, I'm not really scared about it because you just don't seem to notice the time going by. 1 minute you're in a classroom, next minute you're in a hospital as a clerk. I'm sure the next thing I'm going to notice is suddenly I'm a resident or an intern in some hospital, and then next thing I'm a senior resident somewhere, and before you know it, I'm a full physician. I don't think I'm going to notice, really. I think it'll probably be a long time from now before I actually stop and realize that I got somewhere.
Thank you for talking to me, and I'll have a talk with the rest of the infectious disease team, just kind of let them know what's been going on with you.
Alyson finishes her consult on behalf of the infectious disease team. And it looks like there's no bad news coming her way today.
It's been a couple hours since I've been at the hospital, and my phone has been on, and I haven't received a call. I haven't heard anything. So far, it's one of those situations where no news is good news. If you don't hear, you know that you've been matched to one of your choices. So if I don't hear anything by noon, I can pretty much assume that I've been matched to one of my 4 choices for residency.
And Monali has good news about Ryan, who was seizing after surgery.
So that was a little scary. Never want them to stop breathing or anything. And it took about 20 minutes to finally get him out of it, and we had to transfer him to a step-down bed. So he did actually well after that. So it was not too bad, but it was a little scary at first.
Her patients are all stable, so Monali can go home.
Days like this are pretty typical. Usually a 10-hour day is a nice day. It's been a good day. Busy day, but it's been a good day.
On the next episode of Med Students, Monali's on call for surgery. The graduating class gets its residency matches. And Sarah gets high tech in the OR.
I'm just hoping they're not going to make me drive the camera because sometimes they get annoyed if you can't do it very well.